Good afternoon. Would you please introduce yourself and tell us a little bit about your background?
My name is Eileen Moran, and I am a licensed clinical social worker. So that means that I've gone to school I got my bachelor's degree, which actually is in psych, and my master's degree is in social work. I'm also certified in perinatal mental health, mindfulness, and critical incident stress debriefing. So I teach at a university in the area. And the course that I'm teaching is not a social work course. It's for interdisciplinary helping professions. So it's people who are going to be going into the medical field.
So, what is HIPAA for someone who may not know what that stands for or what exactly it does?
HIPAA is the Health Insurance Portability and Accountability Act, which was enacted in 1996. So again, in a nutshell, what it all boils down to is protecting patient information, confidentiality, so that whatever is going on between the patient and the practitioner remains in that room. Obviously, there are certain things that cannot be kept confidential, and that's something that I always review with people, such as expressing suicidal ideations, homicidal ideations. If they're being hurt, that's something that I cannot protect, because I do, in all honesty, have to protect their safety. So HIPAA is there, though, so that I am honoring the confidentiality as the practitioner.
So, are physical and digital records held to the same standard when it comes to staying compliant with HIPAA?
Yeah, so part of being in practice is that I have something called malpractice insurance. And today, unlike when I first became a social worker, I mean, computers were, there were computers. It's not like the Flintstones, but it wasn't what it is today. So I do have that as part of my malpractice insurance to protect anything cyber. So whether it's because I'm doing telehealth or my records are online, I'm corresponding with people, whether it's through text messages or even written or emails, that they're protected.
During the recent pandemic, things like telehealth and video conferencing with doctors became much more prevalent. So, are those kinds of things covered by HIPAA?
That's a great question, because when the pandemic first started, see, in New York State, there wasn't too much of telehealth going on. So we were waiting to hear from then Governor Cuomo, how do we proceed? Because we were all just kind of with our hands up in the air, like, what do we do now? Offices were closed, couldn't meet with people. And then Governor Cuomo said, okay, you can use telehealth and you can use any platform. Now, we all know that not every platform would be technically HIPAA compliant, but because of the pandemic and the emergency and really not being able to contact any outside companies for any help, that's what we used. I signed something called the BAA. So the business associate agreement just helps protect myself, but to protect the client. Everything is encrypted, so it's HIPAA compliant. I let all my clients know that if I'm going to be meeting with them online, that's what I use. I am very fastidious about confidentiality, because ethically, it's important, but it's also very important because I'm protecting the patient and the relationship with the patient, so that the patient understands that I'm very serious about this. I don't discuss anything with anyone outside, ever. I do have paper records, but I don't ever leave anything in an office. Everything travels with me.
So, what are some of the best practices for staying compliant with HIPAA, like document shredding or locking your computer screen?
Before I became a social worker, I worked at a hospice, and I was a clerk. And so this was kind of, it was a very small agency. And so you would kind of talk about what was happening with a patient. The patient would call, there would be an issue. When HIPAA came about, though, and all of the paperwork became involved, we also had to follow certain protocol. Like even with paperwork on your desk, you couldn't leave the paperwork facing up. So anytime you would leave your desk, it just became automatic that you just overturned everything. Your screen, you would make sure that your computer screen wasn't being shown. So as far as compliance would be concerned, yeah, every agency now has shredders. I used to be able to shred where it actually looked because I was so good at it and shredding it up to make sure. But yeah, you have to be very, very mindful of something like that. So along with the BAA, it's also what do you do with your documentation? How long do you keep it for? And when you are going to be getting rid of it, how you would not only maintain the record, but dispose of the record. Even though like this isn't 1980s anymore, a lot of companies still use faxes. And as far as HIPAA is concerned, you cannot fax information without a face sheet.
What are some of the risks for non-compliance, or in your position, what would you be most concerned about?
For me, I think what would be one of the worst things would be a reputation, to be somebody who doesn't honor confidentiality. I take it very seriously. I take my license very seriously. I've been a social worker for over 26 years. So for me, it would be someone thinking that I'm not honoring the relationship. The therapeutic professional relationship is paramount. Everything else can go to the wayside, but that's so important, so imperative to me. You could be sued as well. And again, that's why we have malpractice insurance. Anytime I have a question, I call my malpractice insurance company and I ask them, okay, and I tell people across the board, anytime I have a social worker who is concerned, I tell them, that's what your insurance company is for. You pay premiums, call them.
I'd really like to thank you again for taking the time to speak with me today. Is there anything I missed or didn't cover or didn't have the knowledge to ask, frankly?
I think you covered it very well. But as far as HIPAA is concerned, like I said, when in doubt, I call the insurance company. I don't leave things up to an assumption.